Hi. So today we're gonna discuss regarding what is a Danta Vijanana. The dentition. What says that the background of dentition? Dentition is a unique characteristics of a children, as their teeth are initially erupt during the infancy growth throughout the toddler years, and they will then eventually fall out and make a way for a permanent teeth during the school going period. In easy word, we can say that a dentition. What is a dentition? If a child is born, the first few months or few years, he got the milk teeth, we say, and after that he got a permanent teeth, right? So in easy words, we says, or according to Kashyap Samhita, they have given proper and a detailed explanation regarding how the process of dental eruptions, as well as what is the qualities and features of the different teeth, has been explained in Kashyap Samhita, right? So Acharya Kashyap has been described that the distinct characteristic of a teeth that are erupt during the different months, and along with the what is the specific or particular time regarding that, what is the primary teeth, these things has been provided, right? What is the difference between structures of the male as well as female teeth in children, that has been explained by the Acharya Kashyap. These are the common things of this is a background regarding what is a dantodbhed or a branch of a dentation. Acharya Kashyap has also explained what is the process of a tooth formation, that is organogenesis, from embryonic period till the eruption of the teeth. It has also been explained in the Kashyap Samhita in Dantodbhed Adhyay, right? So what he says in raw material, that raw words, he says that the teeth is developed from the asti bone, right? um, and and majja of what Kashyap says that the he noted what Kashyap has been noted, that the teeth is from the asti bone, forms from the asti bone, as well as the majja, that is a hanavasti, which is hanavasti, that is a mandible bone, right? So from that, the asti has been danta has been formed from the combination of these things, right? So according to Ayurveda, the tooth is considered as a subtype of asti in a धातुगत उत्पत्ति in with that we see has been seen that which is upadhatu, regarding that what is the next dhatu. We have things, we have seen the things regarding that. So there in first year we have seen the that teeth is a byproduct of the asti bone, right? So these are the things has been detailedly explained by the Acharya Kashyap in a Kashyap Samhita. Nextly, Acharya Kashyapa has been explained what is a Danta Sampat, or which are the ideal teeth regarding, or which teeth should be called as ideal. So they have given a shloka, that is a Purnata Samata Ganata Shuklata Snigdata Slakshnata Nirmalta Niramayata Kinchit उत्तरोन्तता दन्तबन्धनानां च समता रक्तता स्निग्धता बृहत्घनस्थिरं मूलता चेति दन्तसम्पुच्य स दन्तसम्पदुच्यते. It has given in a Kashyap Samhita Sutrasthana Dantotpatti Adhyay. So what Acharya Kashyap has been says that Purnata, the teeth has to be complete in a number, should be called as a Danta Sampat or ideal teeth, which says um, it has to be anatomically, should not be devoid of any part, that is enamel, root, neck. It has to be properly formed and should be complete in a number, like a 20 teeth in a children and 28 in adolescence age. Next this is that is samta. So it has to be in even and proportionate form, right? The teeth should be in even, means there should be morphological proportion between different types of teeth, that is it has to be differentiate, that it's incisions, canines, and molar etc. has to be identical to their morphology, right? So incisions are too big and molars are too smaller, then the incisions, then it's called as asamta, which we say in easy word, that is if the teeth in imbalance form, or asamta, which not be considered under this, those. So the teeth has to be in samta, right? Next is the ghanata, that is it has to be the compact form, which is the strongest form of that. So aligned in the maxillary and mandibular bone, it has to be rightly aligned, not any wide range of the gap between that, right? So this is called as ghanata. Next is the shuklata. It has to be whitish or properly white in the form, right? So it has to be white or milkish white in color. Next is snigdhata. It has to be greasy. It should has to be like a glistening substance, right? Next is slakshnata. It has to be smoothness. Regarding smoothness means not softness. Smoothness is something which is lustureness, right? So that is a slakshnata. Next quality is a nirmalta, niramayata, free from any disease, and it has to be clean. Next is the kinchit uttaron, right? It is a slightly elevated in the upper teeth. Teeth has to be lined in the jaw. These are the things which makes the teeth what says ideal teeth, right? That is a teeth sampat. These are the things which has to be in the teeth, and this quality, if a teeth shows this quality, then it considered as a ideal teeth, right? So next we will see regarding the gums. Acharya Kashyap has not only mentioned regarding the ideality of the teeth, but also they have explained regarding what kinds of the gums we had to be called as the samata, ideal or danta sampat or sampat quality. That is a danta badhananam cha. The ideal gum should has to be following characters, which that it has to be samata, that is the even gums. Fresh raktata, that is the flesh like red in a color. Snigdhata, it has to be smooth in consistency, right? Bruhata ghanasthira mulata, compact and stable root, it has to be. These are the qualities regarding teeth as well as the gums, right? So next we will see according to months and according to monthly period, how the teeth has to be formed in a body, and what are their fit and what are their features regarding the formation, right? So we will see that. So according to different months, we gonna see in this chart. So Acharya Kashyap has been mentioned from fourth month, which is given in a next page, or and in this what says paragraph, we sees that in chart Pancha, Shashta, Sapta, and Ashta, 5, 6, 7th, and 8th months. What are their features and what their fits with regarding to that particular period of a time, right? So in a fourth month, the teeth are weakened. So we know if the baby is present in the womb of a mother, then in a fourth month, the teeth are not has to be properly formed, or which is not definitely not formed in a proper form. So the teeth are weakened in this 4 months, and it leads to be the easily breakable form. Next, in fifth month, what said Syandanashta, which is teeth with a loose roots causing movement in the teeth. So definitely in the fifth month, the teeth has not been properly formed. It loose in roots, their roots. So what is the fate of the teeth regarding this? This is a praharshinam amaya bahula, causing a pain. It has definitely caused pain and different dental diseases, right? So these are the conditions in a panchamonth. What is a 6 month or shashtam month? This is malignant, it's a dirty teeth, right? That is a uh, which is the appearance of the teeth are dirty. So what makes the teeth look dirty? That is a mala line, or in easy words, or keep in mind, we says that the teeth are not present in a proper line, or it is present in a mala line. So mala line means the teeth are not present in its original position or proper in one straight line, which has to be in a present anatomically, right? So that is called as a malaligned line, malaligned or ligned, which makes the dirty teeth, right? So discoloration of the teeth and caries are present. In the seventh month, two crown shaped teeth which are easily getting break with the strays. That is, in easy words, the teeth are not formed properly or get easily breakable in a 7 month, even though that is it present in a or it is a broken, dry, and uneven teeth. So in a ashtama month or in 8 months of pregnancy, the teeth are a sarvaguna sampannata, having all characteristics of the healthy teeth. It comes to the purnata, that is urdhva varnanavata, that is complete and healthy teeth. So if the MCQ has been come regarding like which months of a pregnancy the teeth of a baby are properly formed, it called it the correct answer will be the 8 month, right? So the after the proper development, the baby is ready for the parturition or for the delivery, right? So this is a Danta Vijnan given regarding right, these things given regarding Danta Vijnan. So in Ayurveda, some teeth has been given nomenclature according to Ayurveda. That is, if the central canine teeth is called as a Rajadanta, lateral incisor are called as a Basta, canines has been known as Danstra, and premolars has called as Hanavya, and molars are Paschim Hanavya. So these things comes under the Danta Vidyan, and we will next see what are the Dantotpatti Janya Vikar and its management. If the diseases produced at the period of a time of a development of the teeth, which are the diseases, or what is the Dantotpatti Vikaras and its management, we will see. Teething period is considered as what this had given common regarding that this period is considered as a crucial period, and so on. At, at the time of the teeth eruption, some physiological changes has been taken in the body. Additionally, we see when we were children, our milk teeth has been broken out and new permanent teeth has been comes to our, right? So these things has been given. So next we will see which are the Dantobhedjanya Vikaras and its management, we will see in detail, right? So in Ashtanga Devtarstan, given a very important shloka regarding what are the diseases will be produced at that particular period of time. So shloka given as per the Dantodbhedascha roganam sarvesham api karanam ज्वर अतिसार कास छर्दी शीरशूला abhishandya visarpa pothaki sheti, right? So what are the diseases produced regarding that period, particular period of time? So the diseases are jwara, fever, due to what? So the due to different infections of the what, gastrointestinal tract, due to unhygiene with the mouth and habits of a child, like children's bed teeth or nails, etc. Due to that the jur causes. So atisar, that is GIT infection, definitely GIT infection. Next the kasa, coughing and respiratory infections has been probably regarding that. So next is Shardi, vomiting, Shirashula, Abhishanda, Visarapa, and even Pothoki. What is a Pothoki? That is trachoma or other ophthalmic infections or eye infections regarding that, right? So these are the common vikaras which are produced during the period of a Dantodbheda, right? So these are the diseases. So for that particular diseases, or for these diseases, what should be the treatment plan, or what kind of treatment we have to be given? So next we will see regarding that. So in Ayurveda has mentioned Shamana Chikitsa with regarding to that period, that diseases. So what, to prevent the occurrence of the diseases at the time of a dentition, also these diseases can be cured with a different Shamana yoga and local administration of a different medicines over the gums as below. What kinds of Shaman Chikitsa has been given? So they have given some preparations which apply to the gums of the baby or on the gums of the baby, which are the combination, that is Pipali Churna plus Madhu, that is a Dantapali Avachurnartham. So these combination, Pipali Churna plus Madhu, these things will be a combination of these two should be applied on the gum. Dhataki Pushpala plus Amalaki Churna plus Madhu. This is also a particular Kashaya Churna. Kantakari, Bruhati, Vacha, Patha, Kushta, Ativisha, Musta, and Madhura Varga of Dravasnigdha Grata has to be given in a kashaya, etc. things, right? So kashaya pan is also mentioned, and these types of combination will be cure regarding these kinds of problem. Next they have given pitta jwara etc. combinations, kapha jwara combinations, atisara trishna vamana, which has to be given laja, pipali, neelakamala, sharkara, ishti madhu, sanjana, and madhu, etc. things has been given regarding different combinations.